Welcome to the Invite Health podcast, where our degreed healthcare professionals are excited to offer you the most important health and wellness information you need to make informed choices about your health. You can learn more about the products discussed in each of these episodes and all that Invite Health has to offer at www.invitehealth.com/podcast. First-time customers can use promo code podcast at checkout for an additional 15% off your first purchase. Let's get started.
Hi, this is Indeed pharmacist nutritionist Jerry Hickey. I'm also the Chief Scientific Officer over here at Invite Health, and today I'd like to talk to you about a couple of plant ingredients that are useful for people with elevated blood sugar, for people with prediabetes and diabetes. It's from the cinnamon tree, the bark of the cinnamon tree, and from a plant that grows in the Philippines that's in the crepe myrtle family called banaba. Banaba contains something called Corosolic acid, and research is indicating it helps lower your blood sugar. So let's talk about the stats a little bit. According to the National Institute of Health, over 30 million Americans have diabetes. Over 30 million. Big number. An additional 84 million have prediabetes. Their blood sugar is elevated, but not to the point where they could be diagnosed with full-blown diabetes. However, if you have prediabetes, it often progresses into full-blown diabetes. And diabetes is a vicious disease. It's slow poison to your body. For instance, after 10 years of having diabetes, about 80% of people wind up with diabetic retinopathy, where they're getting little globules of fat inside the back of their eye, and the little blood vessels in the back of the eye are bursting, they're developing diabetic retinopathy. Plus, it tends to damage the kidneys, it damages your nerves, it ages your skin, it affects your hearing, it affects your brain, it affects your heart. I mean, diabetes is just horrible. The good news, though, just a little side tip here. Studies are showing now that people who've been diagnosed with diabetes over the past 2 or 3 years, if they start to exercise and eat better and follow certain recommendations, they can actually get away from a diagnosis of diabetes, which is rather amazing. And just a couple of tips. If you need help cutting back on eating, have a glass of water a half an hour before each meal. A big glass of water, 12, 16, 18 ounces. The reason for that, they feel, is that a lot of people overeat because they're mistaking dehydration and being thirsty for being hungry. It's hard to tell the difference. So if you drink a big glass of water a half an hour before a meal, you take care of the dehydration, and you tend to eat less. If you eat less, you gain less fat, and if you gain less fat, that usually helps correct your blood sugar. Another tip is, in general, eat your carbohydrates at the end of your meal. So eat the protein and the vegetables first, eat the carbohydrates last. Because the fats and the protein, etc., and the fiber inside the other foods slows down the absorption of the sugar. It's easier for your body to maintain a more normal blood sugar level. The last thing, a last simple tip, walk for 10 minutes after each meal. Minimally. Better if you walk for 20, because an hour's worth of walking a day is massively important and healthy. I mean, if you walk for an hour a day, it lowers the risk of certain cancers like breast cancer. It lowers the risk of heart disease. It helps get your blood sugar under control. It's a great antidepressant. It even helps with anxiety. It certainly helps with stress. It helps repair your knees. It helps build muscle. It helps lower your cholesterol. It helps prevent heart disease. It helps lower your blood pressure. And it's just fantastic walking for an hour a day. So in New Zealand, the health authorities generally tell people with diabetes, walk for half an hour a day. And they found that generally lowered blood sugar by about, 12%. So they said, well, let's try something different. Let's tell people we recommend you walk for 10 minutes after each meal. Let's split up that half hour. It made a big difference. The people in the study, their blood sugar on average dropped 27%. That means for some people, their blood sugar dropped 20%, which is great. For other people, it might have dropped 35%. So those are 3 simple steps to help you with your blood sugar. 1, walk after each meal. 2, eat your carbohydrates last to slow down the absorption of sugar to help you maintain a more normal sugar level. And 3, have a glass of water about a half an hour before each meal. Now let's get back to these plants. So about 30 million Americans have diabetes according to the NIH, the National Institutes of Health down in Atlanta, and an additional 84 million plus have prediabetes. Their sugar is elevated, but not to the point where it's full-blown diabetes. So cinnamon, good data on cinnamon. Now you know cinnamon as a spice. I mean, it's delicious. Cinnamon comes from the inner bark of a beautiful tree that grows in countries in Southeast Asia and islands off the coast of Asia. Now, the United States Department of Agriculture performed a number of studies on an extract of cinnamon. It's water soluble. So you're actually getting rid of the spicy part, the hot part that heats up your mouth. They called water soluble type A polymers, and they found that these lower your blood sugar pretty dependably. In fact, there's an ingredient out there that they were using in the research called sinulin PF. So the water-soluble version of cinnamon is referred to as water-soluble type A polymers. A polymer sounds like a scary word, but it simply means it's a group of similar-looking molecules bonded together in a chain. So you have natural polymers. So it lacks the spiciness found in the cinnamon, but it's good for your blood sugar. So here's a study. Cinnamon improves blood sugar and blood fats of people with type 2 diabetes. Now, it's 60 people. It's not a huge study, but it's a good size study. 60 people with type 2 diabetes, split down the middle, 30 men, 30 women. They were between the age of 46 to 60. They gave them various doses of cinnamon or placebo for a month and a half. Over a month and a half, the people taking cinnamon, their blood sugar improved by 18 to 29%. Their triglycerides, that's a kind of greasy fat. There's cholesterol or greasy fat, and then there's triglycerides. Their triglycerides improved by 23 to 30%, and their LDL cholesterol, which is sometimes called the bad cholesterol, dropped between 7 to 27%. Their total cholesterol dropped up to 26%. There were no significant changes in the placebo group. The placebo means a fake pill. They weren't taking the cinnamon extract. Using cinnamon in patients with type 2 diabetes, according to their conclusion, will reduce risk factors associated with diabetes and cardiovascular disease. Now, the study's published in the journal Diabetes Care. So here's a second study. This time they're using the aqueous extract of cinnamon, the sinulin PF. It's 80 patients with type 2 diabetes. They were taking medication, but not insulin. They were on a strict diet, many of these people. Then they were given the aqueous extract of cinnamon for 4 months. The cinnamon caused fasting blood sugar to drop by 10% on average, far more than placebo, which was 3% on average. So this is from the European Journal of Clinical Investigation. And there's a lot of studies on cinnamon. Like here's the Joslin Diabetes Center in Boston, Massachusetts. It's a famous research institution. It's the Journal of the Endocrinology Society. It's a 12-week study. And they showed that adding cinnamon to the diet helps keep blood sugar levels stable in people with prediabetes. In other words, prediabetes sugar is a little bit elevated, and these people frequently will transform into full-blown diabetes. Giving them cinnamon was preventing it from progressing from prediabetes to diabetes. Obviously, diabetes is a lot more dangerous than prediabetes. They found that the cinnamon lowered their fasting blood glucose. Fasting blood glucose is like you don't eat for 12 hours. They take a blood sample. Your sugar should be at a certain level. But it also improved the body's response to eating a meal with carbohydrates. Now, that's really important because that's improved insulin resistance. When you have that kind of problem, when you eat a meal and you can't lower your sugar after the meal, that's a powerful sign that you're on the way to developing full-blown diabetes. So this is a very important finding. It's a very important finding. So here's clinical nutrition. Clinical nutrition is the Journal of the European Society for Clinical Nutrition. It's a review of research. And it's saying, how well does cinnamon work? How well does cinnamon lower your blood sugar? So they looked at a group of studies, and they found in patients with type 2 diabetes, cinnamon lowered fasting blood glucose anywhere between 13 to 52 milligrams per deciliter. And it also lowered the HbA1c significantly. HbA1c is kind of like a panoramic 3-month view of your blood sugar. So it really meant something. It really meant something. So you have to weigh these things. If you're exercising and eating right and your sugar's still high, these things for some people will be enough. But for other people, maybe they're put on the drug metformin, and maybe that's not enough. Maybe the sugar's still a little high. Try adding some of these ingredients and see if it could push your sugar back to normal. Because these things are also antioxidants, and they also have other benefits. So here's the Journal of Medicinal Foods. Now, I'm going to talk about 2 different meta-analysis. A meta-analysis groups together a bunch of studies looking at the same thing, and they view the studies as lacking bias, being well-designed, accurately reported. So this is the Department of Nutrition, University of California, Davis, University of California. It's in the Journal of Medicinal Food, and they're using 8 studies, 8 human clinical trials, so that's a review. A meta-analysis like this tells you if something either works or it doesn't work, if it's performed properly. So here's what they found. Meta-analysis in people with type 2 diabetes or pre-diabetes based on 8 human clinical trials. These are all randomized placebo-controlled human clinical trials. That's the state-of-the-art, highest quality human clinical study you could take. Cinnamon, either as whole cinnamon or cinnamon extract, statistically significantly lowers your fasting blood glucose. And that's in people with diabetes or pre-diabetes. Now, if you use whole cinnamon, you have to use a whole teaspoon. So you're better off using the water-soluble type A polymers that you get in the capsule called the Sinulin PF. So in people with pre-diabetes or diabetes, according to a meta-analysis by the University of California, Davis, it works. Cinnamon works. So here's a second meta-analysis. It's the journal Diabetes Research and Clinical Practice. 16 randomized placebo-controlled human clinical trials. Cinnamon significantly reduces fasting blood glucose. So the stuff really works. But there's added benefits to cinnamon. Not only does it lower your sugar and improve insulin sensitivity and reduce insulin resistance, which are all hallmarks of diabetes, it helps lower your triglycerides and your bad cholesterol. It's a very powerful antioxidant. Most spices are great antioxidants, but it also helps lower your blood pressure. So this is a review, 3 human clinical trials. If you take a supplement of cinnamon, if you're pre-diabetic or diabetic, it also helps lower your blood sugar, and it does a pretty darn good job. It lowers your systolic blood pressure about 6 points on average and lowers your diastolic about 3 points on average. So what does that mean? By the way, this is the University of Toronto up in Canada, the University of West London, and London South Bank University, of course, both in the UK. So it's legitimate, dependable research from legitimate, dependable research institutions. And lowering your blood pressure, that top figure in your blood pressure, the systole, is when the heart's actively pumping blood. So lowering that 6 points on average is pretty darn good. But the bottom figure is kind of like even a little bit more important. That's called diastole, diastolic blood pressure. That's when the heart's kind of refilling with blood and it's getting a little rest in between beats. If that's elevated, it's very hard on the heart. I mean, that's a real risk factor for having a stroke, throwing off a blood clot and causing a stroke. So if your heart's pumping 80 times a minute and that pressure's too high, that means the pressure on your heart's too high, like 36 million times a year your heart beats. So lowering that bottom figure 3 or 4 points, that's a significant benefit. So I do recommend cinnamon to people with diabetes. But I have it in a formula, you know. Now, banaba is another reliable, beneficial plant for people with diabetes. There's about 200 plants that are known to help blood sugar a little bit. They don't all work the same way, but some of them are better than others. Like my favorites are Ashwagandha, which basically comes from parts of Asia. Like my favorite plants are Gynema sylvestre, which comes basically from parts of Asia. Fenugreek, which is more near the Levant, near Lebanon and Israel, etc. Bitter melon that you see in the Caribbean. Cinnamon, banaba. Those are very dependable for blood sugar. They're not the only plants that are dependable. There's others too, but these, to me, have the most science behind them. So banaba is a plant native to the Philippines and Southeast Asia, places like Sri Lanka and Vietnam. It's a type of crepe myrtle. It's a species of crepe myrtle. So eventually it becomes a very beautiful tree with typically purplish flowers. Gorgeous. The banaba leaf has been used in Philippine folk medicine for centuries to help people with blood sugar problems, for people with diabetes. And there are certain constituents in it that have a hypoglycemic effect. In other words, they lower your blood sugar, especially something called corosolic acid. In other words, if you get enough corosolic acid from banaba leaf, it dependably lowers your blood sugar. So research shows that for diabetes, research shows that taking a particular banaba extract standardized for corosolic acid, within a short time, within a couple of weeks, lowers blood sugar by 10% on average in people with type 2 diabetes. So within 2 weeks, you can expect some kind of benefit from corosolic acid from banaba. So research also shows that taking a combination product containing banaba and cinnamon, the inner bark from the cinnamon tree, for 12 weeks lowers your hemoglobin A1C by about a little over 0.5% in people with uncontrolled type 2 diabetes. That's pretty darn good. That's really helping correct blood sugar. Now, in pre-diabetes, research shows that taking a product containing banaba and cinnamon, the inner bark of the cinnamon, for 12 weeks improves how well insulin is produced by the body and improves how sensitive you are to the effects of insulin. It's starting to work to pack your sugar away again. So it's really helping people take care of their pre-diabetes. So here's two specific studies. These are researchers from the Department of Diabetes and Clinical Nutrition at Kyoto University in Japan. And they gave people with diabetes 10 milligrams of corosolic acid or an inactive placebo 5 minutes before they took a solution of sugar, a 75-gram solution of sugar. That's what they usually test people with diabetes with. They had diabetes, impaired fasting blood glucose. The corosolic acid helped lower their blood sugar within 60 minutes. So it doesn't work within 15 minutes or half an hour. It takes about 60 minutes. And it reaches statistical significance by 90 minutes. Now the thing is, they've seen this working within 2 weeks. So within 2 weeks, if you take a corosolic acid, 10 milligrams or more, you should see a pretty good improvement in your blood sugar levels. The study's published in the Irish Medical Journal, Diabetes Research and Clinical Practice. In a study of type 2 diabetics who were not using insulin, they gave them corosolic acid. Within just 2 weeks, it really improved their blood sugar. It improved their blood sugar levels by 20 to 30%. It's published in the Irish Journal, the Journal of Ethnopharmacology. So here's a study on corosolic acid from Japan. It's from Suzuka University of Medical Sciences in Japan. It's an evidence-based complementary and alternative medicine. Same kind of deal. By the way, they said they've been using corosolic acid to help with diabetes since 1940. And they said this stuff, within 60 minutes, lowers blood sugar in our diabetic patients. It also helps lower their cholesterol, and it's also an antioxidant. There really is something to this. I have more studies, but I think we've covered it. There are plants, and also minerals, by the way, and other nutrients that can help people with diabetes. So I'm going to try and cover these over the course of the next several months. There's a lot to talk about with diabetes. I want to thank you for tuning into the Invite Health podcast. You can find all of our episodes for free wherever you listen to podcasts, or you could visit invitehealth.com/podcast. Please make sure you subscribe. Please leave us a review. You can also follow us on Facebook, Twitter, and Instagram at Invite Health. And I hope to see you next time on another episode of the Invite Health podcast. And thank you so much for listening.